If you all indulge in me for just a moment for a memento. All right, everyone. Wave and smile. I don't see a lot of waving out there. All right, there you go. Mr. Speaker, members of the board, delegates and friends, colleagues and guests, and particularly our international visitors. One doesn't get to this position by themselves, and I just want to take a moment, going off script here for a moment, and acknowledge my wife and daughter, Deborah Ann and Renee, who are here, who have supported me through all my travels. They're over in this corner right here. Renee has to fly home Monday to present her senior project as she's graduating from high school this year, so we won't have her very long. But I'm honored to speak to you as I complete my term as your president about what we've achieved, where we progressed, and where there's yet work to be done. Through our AMA's work and your leadership, we're reimagining medical education, easing chronic diseases, and ensuring physicians can still put patients first amid disruptive change. Innovative care models are enhancing quality and reducing costs. Millions of previously uninsured Americans are going online to compare prices and buying coverage. We're fighting to make digital health a useful clinical tool instead of meeting simple regulations. And we're moving ahead with innovation in new and exciting ways. These reasons and more may be why our membership is up now 4 years in a row. I like how this movie is going. In my talks with this House, I've drawn metaphors from the movies to describe our challenges and progress. This is my third speech. Last June, I talked about a simple country doctor on a 23rd century starship. And in November, I shared how I became Obi-Wan Kenobi, the intern from a galaxy far, far away. Now, many of you have offered suggestions on how I should complete this trilogy. Bewildered by the maze of regulations, The Matrix, A Noble Quest, Lord of the Rings, our relentless pursuit of regulatory victories, The Terminator. I've decided I like the future. It brings out the optimist in me. So come with me back to the future. There's been a lot of internet traffic lately about the vision of 2015 that was found in the 1989 sequel to the hit movie Back to the Future. In that movie, we see an imagined version of our present day from the vantage point of the past. It hints at what's to come and what's already here. Roads? We don't need roads where we're going. In the Back to the Future 2, Marty McFly is assisted by mad scientist Doc Brown, and they travel decades into the future to save his son from some serious trouble. When we arrive with them in 2015, it looks a lot familiar to us, despite the flying traffic jams of cars. It promises hoverboards, and they're actually working on a hoverboard by a company today using magnetic repulsion, and I want one of those. Of course, in the real 2015, people ask me if I have to check my BlackBerry out from the museum every morning. The movie predicted smartphones, flat-screen TVs, and digital glasses, all now a reality. And of interest to some in this room, in the movie, the Chicago Cubs are World Series champions. Remember, it is a science fiction fantasy. In the Back to the Future's 2015, devices are voice-activated, like Siri, and you can pay for everything with your thumbprint. In the movie, interactive video conversations are commonplace, and is widespread use of tablets as well. all true today, more or less. In looking back at what Back to the Future got right and what got wrong, many people say its prediction that we would all be using fax machines was one of its biggest blunders. In one scene, Marty and Doc pass a post office mailbox that has a little computer terminal on it that says, "Fax here." That gives a pretty big laugh unless you're in a practice that's still faxing paper records back and forth, because electronic records can't interact, can't interoperate with outside systems. While the AMA and the broader physician community strongly supports the use of technology to improve the health of our patients, the meaningful use requirements for electronic health records are a heavy burden and a prison for innovation. For a better future, EHRs need to be interoperable, encourage physician-patient interaction, streamline workload and payment, and promote team care and coordination. We've made some progress in this area. We asked the federal government to cut the reporting period from 1 year to 90 days. They did it. One troubling performance measure, the patient view, download, and transmit requirement, will be eased significantly, at least for now. At least that's a start. I've said this before. We must harness technology to improve care. Don't let it harness us. The same goes true for those who write regulations. Learn from mistakes and act accordingly. If something isn't working, fix it. And if you know something won't work, don't do it. One of the examples of that is our efforts to shut down the Independent Payment Advisory Board, IPAB, an appointed body of alleged experts charged with recommending Medicare provider payment cuts whenever spending exceeds preset targets. Sounds like the SGR on steroids, a visit back to the future we'd like to avoid. And that's why the AMA has criticized IPAB ever since it was created by Congress. That's why we want to end IPAB's future before it happens. The AMA and more than 500 organizations called on Congress to repeal the IPAB, and we've rallied bipartisan support in Congress to get it done. The current Senate bill already has 40 co-sponsors, and the House bill has 232, including 20 Democrats, well on the way to pass in a bipartisan fashion. And good news, the House Ways and Means Committee approved the bill this week. Now we face another challenge, sort of like Biff the bully, ICD-10. And it's going to take more than fancy skateboarding to deal with this one. We believe ICD-10 will further disrupt physician practices when they're already facing headaches like meaningful use. Nonetheless, Congress and the administration seems intent on implementing them on October 1st. The AMA and 99 state and specialty societies have urged CMS to put safeguards in place. End-to-end testing showed claims acceptance rates would drop from 97% to 81% if ICD-10 were implemented today. That's a 20% failure. And that's among the doctors who volunteer, the ones who sit in the front of the class waving their hands. HHS contends ICD-10 isn't to blame, but this may well be the best case scenario. And if Medicare rejects nearly 1 in 5 of the millions of claims they get each day, we'd see a catastrophic disruption to physician practices. So we'll continue to press for more comprehensive testing, a grace period to reduce potential claims denials, hardship exemptions, and advanced payment authority to head off cash flow problems. Now, we've been able to focus even more on these issues because of what the AMA, all of us, accomplished this spring. Like the plot of a good movie, I've been building up to this. And that's the epic improvement to Medicare by eliminating the SGR, led by the American Medical Association, led by physicians, led by you, the House of Delegates. Most of this century, we've been working to rid ourselves of the flawed sustainable growth rate and its fickle, capricious hold over Medicare payments. We all know how the SGR's threats of deep cuts created instability in our practices and sowed uncertainty about access among our TRICARE and Medicare patients. Last year, the message got traction. This year, it broke through. On April 14th, the Senate followed the House and repealed the SGR. I was in Norway for the World Medical Association at that time and watched it unfold at 4 a.m. local time on C-SPAN. A friend of mine who's followed my 23 years of military career and a big fan of military jargon immediately sent me an email with the subject line, "On your watch." Well, I'm proud to say that the elimination of the SGR happened on our watch here. When the president signed it into law, a cheer went up through the land. Organized medicine had won a big victory. The Senate passed it 92-8. Before that, it was approved by 392 members of the House. In Washington, that's an overwhelming bipartisan, bicameral event. Not much seen these days. Working together, we finally ended an era of uncertainty for Medicare patients and their physicians, and opened new avenues to provide better care at lower cost. It wasn't a doc fix. As I wrote in an article for Forbes, it was Medicare that needed fixing, not doctors. More than 700 state and specialty medical societies and other partners rallied with the AMA banner. In the months before the vote, physicians made 60,000 phone calls and fired off nearly 250,000 emails to their elected officials. We lit up social media and set it ablaze. Our action alerts on Facebook, Instagram, and Twitter reached more than 3.5 million online users. Now, there were some doubts, some serious doubts, about whether this effort would get off the ground. Many congressmen were telling us it would be patched for another 6 months to a year. A lot of moving parts had to act together at just the right time and in just the right way. It made me think about Back to the Future. Think of Congress as the flux capacitor. They were fluxing. We revved the DeLorean up to 88 miles per hour, punched in the coordinates, and fueled it with the 1.21 gigawatts of energy put forth by the AMA and America's physicians in a lightning bolt striking at exactly the right time. We burned rubber and smashed through the barriers to success. There are other things to cheer about in the new law. There are annual payment increases through 2019. It streamlines quality reporting programs. Physicians who privately contract with Medicare won't have to opt out every 2 years. Once you're out until you say you're back in. Medical liability lawyers can't use Medicare quality program standards and measures in lawsuits. And we stopped the CMS proposal to eliminate the 10 and 90-day global surgical services bundles. There are also now incentives to use the alternative payment models and the new fee-for-service program. Participation is entirely voluntary. And did I mention annual payment increases through 2019? So, many, many thanks to all of you who participated in this overwhelming and overwhelmingly successful grassroots campaign. Medicine's united voice was loud, it was heard, and it was persuasive. Now it calls for continued physician leadership as change goes forward. We're already working to shape how this law is implemented and making sure it protects physician and patient interests. And America's physicians and the AMA are also sharpening our focus and energy toward improving this nation's health while enhancing the patient-physician relationship. So I hope you'll understand my wish that maybe we can do just one last victory lap. Maybe around this ballroom just one time. Is there a DeLorean in the house? or maybe a hoverboard of some sort. But thank you all for helping us succeed in eliminating the SGR. So Back to the Future talked about 2015, but there actually was a movie in 2015 where we released a movie called RX, The Quiet Revolution. It's a movie that reveals some of the new realities of our healthcare systems. In specifics or in spirit, it reflects much of the AMA's strategic work. It was put on by PBS, it was sponsored by the AMA, and it looked for challenges and opportunities in our healthcare system. It found doctors, nurses, and others at work in teams to lower costs, improve outcomes, and enhance quality. A transformation in the way America delivers and receives medical care. Its stories align with our mission to promote health, prevent sickness, and help people live longer, more productive lives. For instance, in one scene, a diabetic patient in rural Mississippi tests her blood sugar and enters the number on a tablet. Its software sends her to her care team in Jackson, and the number is high. A nurse calls the patient to help her lower her blood sugar. And most hopeful of all, this patient is getting consistently better results. She's now lost weight, and she's sharing her experience with her family, her friends, and her community. Like her care team, she's invested in her own care. This type of interaction between patients and the physician care team is crucial to the AMA's efforts to improve outcomes and prevent type 2 diabetes and cardiovascular disease. Our work is getting results. Most recently, our new partnership with the Centers for Disease Control and Prevention, called Prevent Diabetes STAT, and STAT stands for Screen, Test, and Act Today. This is something that helps physicians tap prevention programs in their communities or online. And it drew from our pilot in 11 practice sites in 4 states, in Delaware, Florida, Indiana, and Minnesota. In the 2015 Back to the Future, Doc got a new spleen and a rebuilt colon at the Rejuvenation Clinic. We're addressing a reality today where our efforts can prevent deadly outcomes and diseases from diabetes and cardiovascular disease from even happening. And that means a better, healthier future. We know as well that tomorrow's physicians need to be better equipped to confront that future. That informs our accelerating change in medical education consortium of 11 medical schools. These projects will help transform medical education, largely unchanged since the Flexner Report a century ago. We're investigating new core science to give them skills to navigate an ever more complex healthcare system and harness new technology to improve patient care. Designing the medical school of the future is not stuff of science fiction, but becoming a real fact, thanks to our AMA and our partners. The RX movie and our other strategic work with partners across the country is showing Americans what we already know. High-quality, affordable care is our priority now and in the decades to come. When our stories are shared, our work is advanced, and our patients win. I'm also proud of the exciting work we're doing at the AMA in innovation. For instance, we're developing initiatives to address technology challenges and opportunities facing physicians, like our partnership with the tech incubator Matter. This health IT hub brings doctors to the technology table and gives them the tools to apply it today for a better future. Imagine if Nathan Davis were to arrive here in Chicago riding a DeLorean this week. I think he'd be overwhelmed by the changes in medicine and the advances we've made. But I think he'd also be pleased and reassured that our mission and goals at the AMA remain true to the course set back in 1847. We've worked for the betterment of public health in everything from medical ethics, education, vaccinations, treating epidemics, and attacking tobacco. Now, the AMA and America's physicians are leading the way toward a new era of better health and a better healthcare system. Thoughts about the future can be clouded by the daily challenges of the here and now. But meeting those challenges today means a better tomorrow. Each victory takes us to the future, one with an ever-strengthening bond between the physician and their patient. Our work to achieve this may never end, but our results will be real and lasting. The reward? Healthier patients in a healthier world. The challenge of change swirls all around us. We need to see it as an opportunity and maximize those opportunities. It will take hard work, imagination, and creativity. I look forward to joining you, working with you, and I'll see you in the future. Thank you.